in part, history will demonstrate the answer to that question. But in terms of the data, you'd have to say that the country and the public service as an element of the country's response has done very, very well. Others have spoken about that, and the statistics certainly bear that out. Can I make two brief comments and then just come back to some of the preparations that we put in place with the advent of Home Affairs? We wouldn't be where we are in part were it not for the extraordinary leadership of some key public service leaders. Can I particularly praise the work of Phil Gaetjens, the head of our public service and the Secretary of the Department of Prime Minister and Cabinet, but particularly as well Brendan Murphy, who was the Chief Medical Officer and then now the Secretary of Health, one of my colleagues on the Secretary's board. Can I also take the opportunity very, very briefly to praise not just the wonderful efforts of our first responders, our nurses, doctors, people in pathology, they're quite rightly often praised, but also our other public servants who have worked diligently in everything from waste management, logistics, trucking, helping with the resupply of supermarkets. It's really been a team effort, and the institution of the public service, I think, has been one of the key success factors to the extent that we've avoided some of the more disastrous consequences that can arise in a pandemic. In terms of preparation per se, can I just say two things very, very briefly, Laura? You've heard other colleagues, including the former Secretary of Health, Jane Holton, talk about the lessons that they learnt from the SARS pandemic or the potential pandemic, MERS, Ebola, and the efforts that were put in place in the 2000s to stand up a very strong public health response capability, and that's borne out in this pandemic. What the Department of Home Affairs did when Mr Turnbull first directed its creation in the middle of 2017, and we opened our doors in December of 17, is that we looked at the non-health, in this case, non-health factors that we'd have to put in place as part of a pandemic response. And that's also stood us in very good stead, whether it's to do with supermarkets, the resupply of supermarkets and supply chains, working with telcos to ensure that there'd be continuity of business and schooling. A lot of that work was done in the background. And finally, Brendan Murphy, my colleague, says you can never plan precisely, and I absolutely agree with him. Yeah. It's the discipline of doing the planning rather than having very specific prescriptive plans, but it's that planning work that really stands you in good stead in these sorts of eventualities.
Yeah, so it sounds like one of the first things your department did do is, I guess, war game a pandemic that might reach Australia's shores. So what have you learned over the last year? Some predict that the next pandemic could be just around the corner and could be a lot more severe than this one. So what do we need that we don't have now?
Well, the experts in this field are always worried about both a pandemic that's virulent, which is to say it's easily transmissible, it's able to be transmitted widely, but it's also lethal. This pandemic has killed a lot of people, and that's tragically so. Its lethality is not as bad as potentially some worse scenarios would suggest. So what it speaks to is having a very strong public health response and public health surveillance to detect the origins of the transmission of such pandemics, particularly when they cross over from the natural world into the human world. And what we've particularly learnt is that your health response is a key but not sole factor. You've got to have a look at your workforce, your schooling, your telecommunications, your connectivity, your ability to basically pull all of society together, which frankly, Laura, short of a war, we tend not to do. We don't mobilise the whole of society to respond to something outside of a war, and this has required national mobilisation. So that's certainly for my department and for me personally, the biggest takeout is national mobilisation.
Well, hotel quarantine has been both the saviour and a bit of a weak link from time to time, as we've seen in WA just recently. Why doesn't the Commonwealth step up? This is a federal responsibility, isn't it?
Well, ministers have addressed that question, and it's really a matter for ministers and in the end the National Cabinet to decide those matters. As a public servant, my job is to provide advice, which certainly I do along with my colleagues, including the secretaries I mentioned and others as well.
And what is that advice? Is your advice, or have you provided advice that it should be from a central body, from the Commonwealth?
Well, Laura, the most important thing in giving advice is to keep it confidential, because it's very important that ministers can rely upon the confidence of that advice. Suffice to say, we've certainly provided across both the Commonwealth, State and Territory public services, full and frank and fearless, no doubt, advice, and I'm sure that my colleagues in the States have done the same thing. And then in the end, it's for ministers and ultimately the Prime Minister and the First Ministers on the National Cabinet to make a decision. The one thing I will say from an operational point of view, an administrative point of view, whichever way you decide to run a quarantine activity in a federation, it has to always resolve down to teamwork, because of course the international border is controlled at the federal level. It's clearly stated as being a federal responsibility, but of course public health is a state response. So you couldn't possibly countenance a situation where people were flooding into the country because you had a border setting that was very open, but then you had very restrictive state public health orders that then prevented the movement of those persons who'd arrived from overseas. So in a federation, it's got to be teamwork.
Mr Dutton criticised the McGowan government yesterday for its handling of hotel quarantine in Perth. Was that based on department advice? Can you tell us whether you did give specific advice?
Well, we haven't. We would never provide specific advice that goes to such a particular issue. Our job is to run the long-term programs, whether it's border entry or border exemption processes, support to states where they're maintaining quarantine services and they rely upon federal support. That's often coordinated through my department, through the Emergency Management Organisation. But as to the public comments either of federal ministers or the comments in response by state premiers or state ministers, you couldn't possibly expect me to comment.
It's also come to my attention that the department and Australian Border Force does not have a chief medical officer at the moment, and that position has been vacant since August. Should we be worried that this is happening in the middle of a pandemic?
No, we have a panel of medical experts who provide us advice. We don't run public health for the general community. Our role in relation to our medical advisors relate to our own workforce, how to keep them safe and protected, including when they're on deployment, for instance, on our vessels, as well as providing us with advice in relation to the care of persons who are in detention and also in relation to the integrity, the health integrity of our visa program. In other words, people coming to Australia are compliant with the visa conditions in relation to their health. So we have a very particular, it's quite a narrow role in relation to health and certainly not in relation to public health. And we have a panel of medical experts who assist us with that work.